Welcome and thank you for taking the time to listen to our message today. Today I'm going to be discussing the Wauwatosa School District's reopening plan for the 2021 school year. As you may know, our district has been reviewing guidelines from the CDC and from Wisconsin DPI, as well as gathering other insights from the results of the surveys that we've been doing that have been sent to families, students, and staff a couple of weeks ago. We've also been consulting with Wauwatosa Health Department and a well-known local pediatrician throughout this planning process. And joining me today is that pediatrician, Dr. Tim Richer. Tim has been practicing at Tosa Pediatrics for 18 years. He is board certified by the American Board of Pediatrics. He's also on staff at 5 local hospitals. So I'll turn it over to Dr. Richer at this time.
Thanks, Dr. Ertl. Hello, yes, thank you. It's been a great privilege being a part of this collaboration. And as many of you know, I was born and raised in Wauwatosa, attended McKinley, Longfellow, and Tosa East. This fall, my kids will be going to Washington, Longfellow, and Tosa East. And that'll make for a fun morning commute for me. So like all of you, I know too and feel that the times are challenging, but I have to say that I've really enjoyed providing some insight and perspectives related to COVID-19. And I'm certain that the science will continue to drive the decisions to make our schools safe this upcoming year. I have a lot of confidence in that. And thus far, I've been nothing but impressed by the degree of dedication and the quality of work our district has already put forth. So it's great to be a part of that.
So I'd like to start by providing a very high-level overview of our survey results that we've received so far. In total, we've gotten more than 3,900 people, including family, students, and staff members that have responded. When asked about preferences for the upcoming school year, the majority of respondents indicated they prefer that we focus on making it safe for students and staff to return to the school building. We've also identified a significant number of safety procedures that would make families and staff comfortable with that in-person learning. So armed with that information and information provided by Dr. Richer, our planning teams have developed the plan that I'm going to discuss today. But before we get into the details of that plan, I want to emphasize that this plan has been developed based on that information that we have today. As new information becomes available, certainly the plan is going to change.
Yeah, absolutely. As we all know, the information is changing so quickly. You know, as we continue to learn more about COVID-19, sometimes those changes come over the course of a workday. But nonetheless, I think it's helpful to review a few of the things that have helped guide our plan. First, as most of you know, coronavirus is the virus that causes the disease, COVID-19. It's spread in several ways, but so far, numerous studies have shown that the primary mode of transmission is from one person to another in respiratory droplets spread by coughing, sneezing, talking, yelling, and even singing. Unfortunately, very recently, there is growing evidence that the virus can also be spread in tinier droplets called aerosols. Finally, it can also be spread by coming into contact with contaminated surfaces. We also know that thankfully, when it comes to COVID-19, kids appear to not be the problem. They are significantly less likely to transmit the virus, less likely to become infected, and even more unlikely to become seriously ill. Child to child and child to adult transmission is very rare, and even more so when other safety measures are put in place. We also know that the safety measures work. Right now, to prevent COVID-19, it's critical that everyone wear a mask as much as possible, maintain social distancing, and cover sneezes and coughs. Hand washing and sanitization procedures also minimize the spread of the virus on surfaces. But no single preventative measure is enough. And although masks are the single most important measure, all measures together yield the best results. Finally, we have national, state, and local institutions and more science every day to help guide us if children and staff become ill, if they become exposed to the virus, and if they become infected. And armed with all of that information, I think our district has gone to great lengths already to make sure that we continue to do all we can to keep our schools safe.
Just speaking of masks, I just want to remind everybody that if you come into our schools, that masks are required for everyone, and for the foreseeable future, that will remain in place. So Also, based on this information and feedback and guidance that we've received and analyzed, we intend to begin our school year with face-to-face learning full-time. We want to safely get back to full-time face-to-face learning as soon as possible. That being said, we're also going to have to be flexible in our ability to deliver instruction in any context. For example, if we find that cases of COVID-19 are popping up in our schools, we are ready to quickly move to a hybrid model that decreases classroom size but still provides students with an opportunity to learn in person each week. This would help to mitigate additional spread and keep us from having to move to full virtual learning. That being said, we're also prepared to move to that for short-term or long-term closures due to the positive COVID-19 cases. We also recognize that some families might be uncomfortable sending students back, so we're working to have a virtual learning option for those parents and those families. And a full-time option for elementary students, and for our secondary students looking at Wauwatosa Virtual Academy, which has successfully been run for a number of years. We will provide additional information on all of this as it becomes more available and more finite and defined.
Yeah, I think the face-to-face intention is exciting, but at the same time, the virtual option is a really good fit for certain students. A minority of students learn better this way. Some families may simply feel safer this way. And of course, some children with underlying medical conditions might benefit as well. So families may want to have discussions with their physicians to help guide their decisions.
And along with that, I mean, we want to build confidence for our families to be able to come back into the buildings, and for our students and for our staff. And we're making some changes in that regard as well. So our buildings are going to look a little different, and the day-to-day norms for our students and staff are going to change. Safety and security of students and staff is going to continue to be our primary concern and even be ramped up during these times. We're going to increase our cleaning, our sanitization, and our safety procedures in our buildings, including, but certainly not limited to, modifying our cleaning protocols and increasing the frequency of those protocols, installing plexiglass barriers in spaces that require close interaction. So where the public comes in and parents come in to meet with staff, we'll have plexiglass. We've already begun the installation of new HEPA filters to increase circulation of outside air and make sure the inside air is healthy air. Adding sanitization stations for students and staff to practice good hand hygiene. And we're going to limit visitors and volunteers into our buildings. Parents are going to be able to enter under current plans by appointment only. Our student norms are going to change in a few ways, but certainly, again, not limited to these as we move forward and find better ways to make sure our people stay safe in the buildings. We're going to try to limit student movement. So a majority of elementary instruction will take place in just a single classroom. Secondary, we're working on it. We don't think it's as reasonable to put students into one class, and really difficult to find a way to make sure that their instruction takes place in a positive way. Elementary students right now are going to eat their lunch in classrooms. Secondary students are going to be able to spread out more, but still a challenge that we haven't completely figured out, but we will by the time school starts, and where they're going to be eating, more than likely in classrooms, hallways, and in the lunchroom. We're going to eliminate shared supplies, only small group. Walking field trips are going to be allowed. We're going to implement a soft landing drop-off for secondary, which for many of you, you'll be familiar with that at a number of our elementary schools. We have done that, and we'll do that at all of our elementary schools now as well. Pickup times are going to remain the same. Really going to encourage walking, biking, and single-family transport to and from school. One of the advantages of Wauwatosa, and I know some people at times have struggled with the fact we don't provide transportation, but this is one of those times where it's a good thing for our school district that we're not trying to address busing issues at a high level. Certainly we have some busing. And then students that do get to and from school on those buses are going to see staggered seating. For students with special needs, we're going to work with the bus company to make sure we have shields installed and work on that staggered seating as well. And of course, we're going to work to accommodate any and all high-risk students based on their individual doctor's recommendations.
And I think those are all great ideas because, as I mentioned before, right now we understand that COVID-19 is spread in those three major ways: droplets, aerosols, and contact on surfaces. And the research currently shows that these operational changes that are going into effect are the most effective way at preventing the virus transmission. However, we're learning more, as I said before, every day. And we will, of course, be vigilant. I and my partners here, of course, will be vigilant. And as new research unfolds, we'll evaluate it and use CDC, state, local, any guidelines that can help move us forward and provide us information so that we can respond appropriately.
As an example, we've learned that there's less value in taking temperatures of staff and students than previously thought. We've also determined that the time required to take the temperature of all of our students and do it in a private, confidential way is not feasible without significantly cutting into their learning time. So that being said, we've determined that we're not going to be taking students or staff's temperature as they enter our buildings. And I think, like with every decision that we make, we're going to balance out the benefit to the cost of time and energy and the impact on student learning.
Yeah, exactly. And on that thermometer note, just days ago, literally, it seems as though we were counting thermometers. But now even our local hospitals have stopped routine temperature checks because the newer data simply doesn't support it. However, because we're not doing those things at the school, it becomes even more critical then that families continue to monitor for symptoms at home and perform daily assessments to confirm that students are well. And if your student shows or complains of any symptoms, they should not attend school and should be tested for COVID-19, which is a little bit of a change. Sometimes we're used to sending our children to school when they're just a little bit off or have just a sniffle or just a little cough. And unfortunately that, for now, for the foreseeable future, will need to change. You'll be familiar with most of these, but it's, of course, not just cough. Other symptoms include fever of 100.4 or higher, runny nose, congestion, I mentioned, that aren't related to allergies, shortness of breath, again, any new or worsening cough, vomiting, diarrhea, sore throat, muscle aches, and also loss of sense or of taste and smell. It's a long list, and we appreciate the difficulty that families are going to face screening for those or thinking about those on those busy mornings. But also, if your student's been exposed to somebody with COVID-19 or has been told to isolate, again, your student should not attend school and should be tested.
Great advice, and I know that sounds like a lot of testing. And we are creating an FAQ page, which includes links to testing sites in the Milwaukee area. And as a school district, we're also working on partnerships with medical facilities, including Tosa Pediatrics, so that our staff and students can get tested and get the results quickly.
It is a ton of testing. We're so used to riding certain little illnesses out, and until there's an effective vaccine, we plan on testing every symptomatic person. That's what the state wants us to do as well. But that testing is for a reason. It plays a major role in containing this disease, not just in Tosa, but across our state and the region as well. And at Tosa Pediatrics specifically, we're aggressively gearing up for high volume testing. If all goes as planned, some of that testing will yield results in under an hour. However, at worst, our goal is to have results back the following day so that staff and students, whoever we test, are able to get back to teaching and learning as soon as possible.
So one other thing, I know many of you are wondering if we're going to be requiring students and staff to wear masks. And as I mentioned earlier, and as it stands today, anybody who enters a district building must wear that mask. It's subject to change, but it doesn't mean we won't require masks in the fall. We're going to have to see what our landscape looks like, our environmental landscape in relationship to COVID and how things change. Really make a determination based on facts. And we'll make sure we communicate that out to families and students prior to the first day of school.
Yes, and again, in the meantime, I would encourage families to wear masks out and about as much as possible. Since nearly all transmission to children is from adults, and nearly all transmission to adults is from adults, it's up to us, adults, to keep our children healthy and each other healthy so that they might miss as little school as possible. Their academic growth, but also equally as importantly, their emotional growth literally depends on wearing masks.
So I'm sure many of you have questions, and I encourage you to visit wauwatosaschools.org/reopen to learn more. The page is going to serve you as a hub for all of our information related to our opening plan for next year, this coming school year. The page has a form that you can use to submit feedback as well, and we're always open to hearing and getting more feedback that really helps guide our planning process. We're going to be sending out a survey to get a better idea of how our families feel about our reopening plan and to get additional feedback. I'm confident in the resources and data that we've used to develop our plan, and I trust that our community will work together to ensure the safety and success of our students and staff. When we look at Wauwatosa and what Wauwatosa really stands for, it really is a family. And we need our community, we need everybody in our community to make this work for our students so we can get back to school and get our kids learning and our staff engaged with our kids. I think that's what everybody wants, but we all have a role in making sure that happens. So thank you again for taking the time, and thank you to Dr. Richard for spending some time with us as well, and for all your time that you're putting into our planning committee. It's been fantastic. So thank you.
Thank you. Thank you.